Hello, Jonna.
Hello, Jonna. Thanks for having us.
Hi, how are you guys this morning?
Very good, thank you.
Great. So let's go ahead and get into our interview this morning. So my first question is for Dr. Gabriel. How common is it for women to choose the option of having a mastectomy or a double mastectomy, and what are most women's reasons for having that type of surgery?
Well, women with breast cancer choose to have some sort of an operation to remove their breast tumor. Over the last 10 years, we've seen a tremendous increase in the double mastectomies, and that's according to the Susan G. Komen Foundation. We've seen that about 17% increase per year. The treatment of breast cancer is only part of the journey, and it's extremely important for patients to be educated and informed about the breast reconstruction option because they deserve to know that information.
Now, tell me a little bit about exactly what happens during the mastectomy or reconstruction, and is it a complicated surgery? How complicated is it?
Well, during the mastectomy, the breast tissue is removed. Whether the patient is doing it for preventative or for breast cancer reasons, the breast tissue is removed and reconstructive options are offered to the patient. During the reconstruction, the breast is rebuilt, and over the last 2 decades, we've seen a tremendous increase in the surgical techniques and surgical products that are available to us so we can better serve our breast cancer patients. Some of those 2 exciting innovations are the alloderm tissue matrix brought to you by Celity, who we're partnering with today, as well as the fat grafting methods that give us better options for our surgical reconstruction for our breast cancer patients.
Now, Sherry, I want to definitely ask you some questions. First of all, congratulations on being a breast cancer survivor. So tell us a little bit about your experience. What type of surgery or reconstruction did you decide to have, and why?
Well, I was diagnosed 3.5 years ago with breast cancer, and at that time my surgeon gave me different options for my treatment. And one of them was to have a bilateral mastectomy with reconstruction, which I did choose to do. I wanted to get back to the normal me, to feel normal and myself again. And I found that by having reconstruction, it gave me another tool to make it through that breast cancer journey, because it's an extremely emotional journey, and I felt that the reconstruction really addressed my emotional strength so that I could return back to a normal life and not have breast cancer rule my day.
Wow, that's amazing. So now that you've been through the experience, you've had the surgery, what advice would you have for other women who are having to make the same decision that you had to make?
Oh, without question, they need to educate themselves. Talk to your surgeons, talk to your neighbors, talk to other breast cancer patients. Take advantage of local breast cancer support organizations to get input from them. There's getting to be more and more information on the website and in different locations. You have to do your homework. Get some consultations with a couple of different breast cancer reconstructive surgeons who specialize in that particular type of surgery, so you have your best outcome. For me, like I said, it's helped me through this journey emotionally to get back to normal life.
Now, Dr. Gabriel, can you tell us a little more about how patients can do exactly what Sherry said, which is to do their research and get educated and informed? What can patients do to become more informed about their options, even before they have to face the choice?
Absolutely. As Sherry already stated, the knowledge is power, and for these brave women, it's extremely important for them to be educated. Not every patient is going to choose to have reconstruction, but every patient deserves to know that they have the option to have reconstruction. And why there's even the local as well as regional websites, resources that patients can turn to. One of the ones that I always recommend is breastreconstructionmatters.com. That's again, breastreconstructionmatters.com. And it's a great resource, great site for patients to navigate through and find out their different options of what's available to them.
Now, since my audience is a majority of African American women or women of color, is there any information that you can share specific to that community of patients? I often hear that that community of patients sometimes does not get the attention that they need, or they don't inform themselves as often as they should. Like, is there anything specific to that community that you would that you can share?
Well, that's a great point that you're bringing up, because we know that African American women as well as minorities do not seek to have reconstruction. And one of the things that we have encouraged is turn to your local foundations. Susan G. Komen, look for the funding that's available. Also, American Society of Plastic Surgeons has a great website that you can turn to find out more options. But it's extremely important for them to know that reconstruction is available for them, and there are surgeons that are performing the reconstruction. They just need to have the avenue and have the resources to get there. And between all these websites, we're really hoping that we are able to target this population and we're able to better support them.
Well, thank you so much. This is great, a great conversation, because while we focus so much on prevention and early detection, it's also great to share the sort of other side of the coin, which is the decision to have the reconstructive surgery. So I appreciate you guys for taking this time this morning. Thank you, Dr. Gabriel. Thank you, Sherry. I really appreciate you taking the time this morning.
Thank you, Jonna.
You are so welcome. It's our pleasure.